My name is Caroline Shelton, and this is my Country Health Status Report on the country of Cuba for Nursing 310. The country I have chosen to focus on this semester is Cuba. Cuba is a country located in the Caribbean Sea that has a total area of 42,426 square miles. A communist government has been in place since the late 50s. Currently, 11.1 million people reside in the country of Cuba. When it comes to healthcare, Cuba operates under a universal healthcare system, and they are known to have the highest doctor-to-patient ratio in the world. In result of this, their doctors are highly demanded all over the world. Population health status and health problems in Cuba. The World Health Organization lists the risk factors in Cuba as water, sanitation, and vectors. Many diseases have become common in Cuba due to these risk factors. Some waterborne illnesses include hepatitis A, hepatitis E, and typhoid fever. Malaria also has a high incidence due to vectors. In Cuba, foodborne illnesses are also common, including hepatitis A. However, the percentage of malnutrition in children is 7% in the rural areas, and overweight children are seen in 5% of the population. Obesity seems to be more of an issue in the adult population. Research shows that 37% of women and 32% of men are obese in the country of Cuba. Overview of the healthcare system in Cuba. Cuba is known worldwide for their healthcare system. They have made many medical advancements, and it is something Cubans take a lot of pride in. The success is due to their primary healthcare system. The government gives priority to disease prevention, universal coverage, and all access to treatment. However, Cuba has special clinics for tourists, politicians, and VIPs who they reserve the best doctors and medical professionals for, making it difficult for ordinary Cubans to get the health care they deserve. According to the World Bank, Cuba spent 10.57% of its GDP on health, which is slightly higher than the global average, classifying them as upper middle income. Comparisons with the United States of America. According to Healthline, the United States spends more than $9,000 per person on health care, and Cuba spends less than $3,000 per person on health care. Cuban leaders have also made a commitment to health care for all citizens. Cuba brings doctors and nurses to their citizens, so they have constant access to health care. Cuba's success mainly comes from their focus on preventative care and how they stress the necessity of vaccinations. In contrast, the United States has high cost, and many people do not get the care they need due to deductibles and other reasons. Culture, religion, and economics. As I previously mentioned, Cuba's healthcare system is free for all of its citizens, which is something their economy takes pride in. Cuba is known for a culture full of very kind and helpful people. Ivy Gibson, whom I interviewed, witnessed this culture firsthand. Cuba currently has around 50,000 medical professionals in 67 different countries, which shows their willingness to help others. Cubans are also very research-driven people. In 1985, they pioneered the vaccine against meningitis B, and since then have developed new treatment against hepatitis B, psoriasis, vitiligo, and HIV, and many more. Cuba manages to save money due to the low pay for doctors. However, these doctors are the most profitable resource for the country of Cuba, and they are proud to be recognized all over the world for the work that they do. Recommendations for improving health in Cuba. In result of Cuba being a low-income country, they focus more on preventative care. This can help save the country money by not needing to have as many resources for diseases since they are prevented. However, many of the diseases Cubans suffer from result from improper water sanitation due to droughts. In my interview, I learned that the water in Cuba is unsafe to drink, which can lead to citizens contracting diseases that are not easily prevented. One theory is to improve water sanitation in Cuba, and this is by installing slow sand filters. According to a century-old concept, water trickling through the sand will purify the water and remove bacteria and parasites that make people sick. If this cost-effective practice spreads throughout Cuba, it will improve health outcomes of its citizens by preventing waterborne illnesses. Summary of the interview with Ivy Gibson about Cuba. For my interview, I spoke to my classmate, teammate, and personal friend, Ivy Gibson. Ivy visits Cuba twice a year. As long as we have known each other, she has made it well known to me that the people of Cuba have a special place in her heart, and she loves to dedicate her time to helping as many Cubans as she can. In the interview, she explained that the health and hygiene in Cuba depends on the location. They normally visit the poverty-stricken parts of the country. She also explained that due to the specific zones in Cuba, getting to a hospital or another healthcare facility can be difficult for some citizens, and their low income level makes it difficult for them to get what they need. Ivy explained to me that because of the poverty, this causes the culture to feel a little more old-timey, but this does not make their attitudes waver. She explained that they are very loving people regardless of their income. On her mission trips, she and her group only drink bottled water. She explained to me that the water in Cuba is very disease-ridden. However, she said it has come a very long way since her first visits to Cuba. In conclusion, the main source of illness in Cuba is from poor water sanitation. One of Cuba's biggest accomplishments is universal health care, which makes them superior to the United States, where costs are very high. In result, Cuba has made many advancements in medicine and will continue to do so. Lastly, here are my references. Thank you so much for listening to my Country Health Status Report on the country of Cuba.